So, good day everyone. I am alay-ay from North Valley College Foundation Incorporated, taking up Bachelor of Science in Nursing, Section A. So, for today's return demonstration, I am going to perform the Essential Intrapartum Newborn Care or the EINC. So, the EINC practice are evidence-based standards for the safe and quality care of birthing mothers and their newborns. So, prior to the conduct of this procedure, I already secure all the equipments that I'll be using in this said procedure. So I have here a thermometer, a cord clip, clamps and scissors, cotton balls that is soaked with alcohol, a kidney basin, a baby's cloth, sterile gloves, vitamin K and hepatitis B injection, the oxytocin injection, the BCG vaccine, and the eye ointment. And also I have performed hand washing. This is to prevent the spread of the microorganisms. So, good morning ma'am. I am alay-ay and I will be your student nurse for today. So, may I see your wristband ma'am? Okay, so before we proceed to the delivery, do you have any questions or concerns before we proceed? Okay, are you comfortable in your position right now? Okay, so today ma'am, right now, your progress of labor is currently in 7 centimeters, so it is not still fully dilated, so we should wait or we will wait for another minute or for a while. So next we have to ensure if there are any air drafts. So I am going to use this paper and drop it on the floor. So if this paper goes directly to the floor, that means there is no air draft. Okay, so the room temperature should be 25 to 28 degrees Celsius and the windows and doors should be closed. Okay, the next thing that we're going to do is we're going to remove the unnecessary jewelries. And then, in preparation, we're going to clean the perineal area of the mother. So, Mrs. Smith, I am now going to clean your perineal area. So, is it okay with you if I expose your genital part? Okay. So now we're going to dispose this used materials. Okay, so now I'm going to wash my hand and apply or put on 2 pairs of gloves. Okay, so now I am done. So now we're going to the process of ongoing delivery. So Mrs. Smith, for us to deliver the baby, I want you to push for me, okay? And we will also do the breathing technique as well. So please inhale and then exhale. So, okay, on a count of 3, 1, 2, 3, push. 1, 2, 3, push. Okay, place a dry linen over the mother's abdomen. This is for the preparation for the baby's arrival. Again, on a count of 3, 1, 2, 3, push. 1, 2, 3, push. Baby boy out 12:30 a.m. Okay, so Mrs. Smith, you did it. Congratulations. So place the baby on a dry linen and wipe the eyes, the face, and also the entire body of the baby. Okay. Then place the baby on the mother's abdomen for the skin-to-skin contact. Okay. Then we're going to dispose this used material or linen on a disposal area. Okay, so again, put a dry linen on the baby and also a bonnet. Okay, so the next thing that we're going to do is we're going to palpate the mother's abdomen in preparation for giving oxytocin injection. Okay, so now we're going to inject the oxytocin intramuscular. Okay, and then we're going to remove the first pair of gloves. And dispose it properly. Okay, so the next thing that we're going to do is we're going to palpate the umbilical cord and grab the clamp and clamp it 2 centimeter. Okay, then milk the cord. Then again, clamp the cord 5 centimeter. Then cut the cord near the clamp, not midway. Okay. So now we'll assess the uterus and the placenta. So massage the uterus and the mother's vagina for any laceration or tears. Okay, so now we're going to assess the mother's placenta after delivery. Okay, so the placenta seems complete, no missing cotyledons, and no abnormalities. Okay, so now Mrs. Smith, I am going to clean your perineal area to avoid any infection and put on perineal pad or napkin. Okay. And we're going to dispose it properly on this disposable bin. Okay, so assess the baby's color and breathing. So as I observe, the baby's color seems good and the breathing is normal. So now we're done. So mom, how are you feeling today? Are you still comfortable in your position right now? Okay. So now I am going to remove my gloves. And dispose it properly. Okay, so Mrs. Smith, I want you to watch out for feeding cues which indicate that the baby may feed on you. So if you identify some of those feeding cues, you can hold your baby close to your nipple and wait for the baby to open its mouth and catch on your nipple. So after successfully breastfeeding the baby, we will apply now the eye ointment on the eye of the baby. Okay, and now we are going to inject the vitamin K on the baby's right leg. Okay, and also we're going to inject the hepatitis B on the left leg. And then, next we're going to inject the BCG vaccine intradermally. Okay, so Mrs. Smith, bathing procedure should be delayed. This is advised at least 6 hours after your baby's delivery. This will prevent the baby from having hypothermia. Okay, now we're going again to assess the color and breathing of the baby. So as I observe, it's still in good and breathing is normal, and the mother is in comfortable position without any lacerations or tears. So again, Mrs. Smith, congratulations, and it is very important to clean the area to avoid any infections or contamination. So now I'm going to dispose these used materials properly on the disposable bin. Okay, and I am going to wash my hand. Okay, after washing my hand, now we're going to do the documentation. So it is very important to document all the findings of the said procedure. So that would be all. Thank you everyone for watching and have a nice day.